Coming to the sleep, sleep is defined as unconsciousness from which the person can be aroused by sensory or other stimuli. It is a physiological process by which body functions are periodically rested. It is to be distinguished from coma, which is the consciousness from which the person cannot be aroused. Some of the physiological changes during sleep can occur are in the cardiovascular system, heart rate, cardiac output, vasomotor tone, blood pressure decrease. In the respiratory system, tidal volume, respiratory rate, pulmonary ventilation decreases, BMR decreases, urine volume decreases, while phosphate content and specific gravity increases, therefore more concentrated urine is formed. Amongst the secretions, salivary and lacrimal secretion decreases, sweat secretion increases, gastric secretion either remains or unaltered, or it can increase. Muscles are completely relaxed and tone is minimum. If you see in the eye, eyeballs roll up and out due to flaccidity of external ocular muscles. Eyelids come closer due to the drooping of the eyelid, pupils constrict, blood volume increases resulting in dilution of the plasma. Then in the nervous system, EEG shows appearance of delta waves and the deep reflexes are reduced, superficial reflexes remain unchanged and light reflexes retain. There are different types of sleep. They are categorized into the NREM type and REM type. So NREM type is non-rapid eyeball movement sleep or slow wave sleep. In NREM sleep, it is divided again into 4 stages. Each successive stage will have an EEG pattern with a slower frequency and high voltage than the preceding one. Initially, there is a considerably tone in the postural muscle and it progressively decreases. The eyes begin to slow rolling movements until they finally stop in the stage 4, that is in deep sleep, with the eyes turn upwards. During NREM sleep, there is a release of both growth hormone and gonadotropins from pituitary. Body metabolism is lowered. Also, there is a decrease in the blood pressure, heart rate, and respiratory rate. When awakened, person does not report dreaming. After a person has been in NREM sleep for about an hour, the sequence of sleep stages is repeated in reverse order. That is, the person passes from stage 4, 3, 2, 1 and then he finally enters into the REM sleep. The REM sleep, that is rapid eyeball movement sleep, or it is also called as paradoxical sleep. During REM sleep, the eyeballs move frequently with the saccadic eye movements. Saccadic eye movements are small jerky fast movements that rapidly bring the eyes from one fixation point to another and may be associated with watching visual images of dream. Here EEG shows desynchronized pattern. Dreaming is closely associated with this sleep. When awakened, the person report that 80 to 90% of the time they had been dreaming. The REM sleep is associated with increase and irregularity in the blood pressure, heart rate, and respiratory rate. The skeletal muscle tone markedly reduced. This is responsible for snoring during sleep, as a relaxed tongue in the supine posture partially obstructs the air passage. The REM sleep is associated with large phasic potential in groups of 3 to 5. They originate in the pons and pass rapidly to the lateral geniculate body and thence to the occipital cortex. Therefore, they are called as pontogeniculo-occipital spikes, that is PGO spikes. This activates the reticular innervating area in the medulla, producing the hypotonia. Teeth grinding, that is bruxism in children, erection of penis, engorgement of the clitoris, and twitches of the facial or limb muscles may occur in REM sleep. Sleep cycle. A sleep cycle consists of 2 phases as NREM sleep followed by REM sleep. The continuous recording of adults shows that average total sleep period comprises of 4 to 5 such cycles and each lasting for 90 to 100 minutes. In a typical 90-minute sleep cycle, NREM sleep occupies the first 70 minutes and REM the last 20 minutes. So these are the different stages of NREM sleep, that is stage 1, stage 2, stage 3, stage 4 and REM sleep. Initially, the sleep starts with stage 1, stage 2, stage 3, stage 4 and then it reverses back like stage 3, stage 4, stage 1 and then there will be NREM sleep. So like this, there will be at least 3 to 5 cycles in a total sleep hour of 8 hours. Genesis of sleep, genesis of NREM sleep, inhibition of reticular activating system inputs by descending pathways which arise from the preoptic and diagonal band of Broca. It also occurs because of the stimulation of the sleep promoting mechanism, that is the rhythmic discharge from the thalamus. These mechanisms get influenced by diencephalic sleep zone and medullary synchronizing zone. Diencephalic sleep zone present in the posterior hypothalamus, interlaminar and anterior thalamic nuclei, whereas medullary synchronizing zone is present in the reticular formation of the medulla oblongata. Mechanism that can cause sleep. It is important stimulation area for the sleep in the raphe nuclei in the lower half of the pons and medulla. The nerve fibers from these nuclei spread locally in the brainstem, reticular formation and also upward to the thalamus, hypothalamus and most areas of the limbic system and even the neocortex of the cerebrum. In addition, fibers extend downward into the spinal cord, terminating in the posterior horns where they can inhibit incoming sensory signals including pain. The nerve endings of fibers from the raphe neurons secrete serotonin. When drug that block the formation of serotonin is given, then the sleep is deprived for several days. Therefore, it is assumed that serotonin is a neurotransmitter substance that associated with production of sleep. Stimulation of some areas of the nucleus of tractus solitarius also causes sleep. Stimulation of several regions of the diencephalon can also promote sleep, including the rostral part of the hypothalamus and an occasional area in the diffuse nuclei of thalamus. Genesis of REM sleep. Genesis of REM sleep is due to two factors, that is discharge of norepinephrine from the neurons located in the pontine reticular formation and locus coeruleus. And cholinergic system is necessary for shifting of NREM to REM sleep. Reserpine, a drug which depletes the serotonin and catecholamines, blocks the slow wave sleep. Barbiturate, the drugs which decrease the amount of REM sleep. Coming to sleep disorders, insomnia is a condition of being unable to sleep. Somnambulism or sleepwalking is a more common in children and may last for several minutes. Such individuals walk with their eyes open and avoid obstacles, but when awakened, they cannot recall the episode. Nocturnal enuresis is involuntary voiding of urine during sleep at night. And narcolepsy is a disease of unknown cause which there is uncontrolled urge to sleep during daytime activities. So these are some of the changes which we see in NREM sleep, the behavioral as well as EEG changes. In stage 1 NREM sleep, this stage is of drowsiness and falling asleep. It is characterized by easily aroused by moderate stimuli or even neck muscle jerk, and it is a continuous lack of awareness. EEG changes, alpha waves is reduced in frequency and amplitude. In stage 2, it is a true sleep and there is a further lack of sensitivity to activation and arousal. The EEG changes are characterized by appearance of sleep spindles, that is due to the reverberating activity between thalamus and cerebral cortex. These are the bursts of regular alpha-like waves 10 to 14 Hz and 50 millivolts, and appearance of alpha rhythm in between beta rhythm is known as sleep spindles. In stage 3, the sleep deepens and the ECG changes where sleep spindles are occasional and are now superimposed on background of waves of delta type. Stage 4 is a stage of deep sleep in which it is difficult to arouse the person. Arousal occurs only with vigorous stimulation, and when awakened, the person does not report dreaming. And the EEG waves here are slow and high voltage delta waves, where the REM, the paradoxical sleep, it is the deepest sleep. The REM sleep is also called as paradoxical sleep because the sleeping person, it is difficult to arise despite of having desynchronized EEG that is characteristic of alert and awake state. The skeletal muscle tone is markedly reduced except in the eyes where the REM occurs. And REM sleep and dreaming are closely associated. REM sleep is more towards the morning, and hence dreams are more recollected during early in the morning. Then ECG becomes desynchronized here, that is low voltage fast activity is seen resembling that of awake state with eyes open, that is beta waves pattern. Large spikes are seen in the EEG called PGO spikes, that is pontogeniculo occipital spikes, which are characteristic of REM sleep. These are some of the difference between REM and NREM sleep. In NREM sleep, there is a hypotonia. In REM, there is more hypotonia. The REM shows slow high voltage delta waves, and REM sleep shows low voltage beta rhythm waves. In REM, no rapid movement of the eyeballs, where the rapid movement of the eyeballs occurs in REM sleep. In NREM, dreams cannot be recalled, or vague recalling dreams can be recalled easily in REM sleep. No, in NREM, there is no pontogeniculo occipital spikes, but PGO spikes are present in paradoxical sleep. These can be recorded from the occipital cortex. PGO spikes take origin from the pontine reticular formation. In REM sleep, pulse, blood pressure, respiration are lowest and regular, whereas pulse, BP, respiration increased and are irregular in paradoxical sleep. In REM sleep, serotonin content of the raphe magnus nucleus is associated with slow wave sleep, whereas noradrenaline content of the locus coeruleus is associated with paradoxical sleep. The NREM sleep threshold for arousal by sensory stimulus is elevated, where threshold for arousal by sensory stimulation is further elevated in REM sleep. The NREM sleep occupies almost 75% of the total sleep, whereas it is 25% is REM sleep. In NREM, brain activity is less, and in REM sleep, the brain activity is